All right. Good afternoon from the Child Study Center. I'm Richard Gallagher. I'm a psychologist here at the Child Study Center and an associate professor of child and adolescent psychiatry. For questions, you can submit questions at any time during today by typing into the questions pane on the right side of your control panel, and we will answer questions at the end of the presentation. We're gathering those together and putting those together. So today we're going to talk about building organizational skills and executive functions in children with ADHD. Based upon some of the information I'll be providing, there are some conflicts. We do receive royalties from the Guilford Press for books that we published on the topic, and our research grants have recently been supported by some private foundations. I want to talk about executive functions and organizational skills because these are both topics that have received a lot of attention lately, especially in dealing with kids with attention deficit and hyperactivity disorder. There's been a lot of emerging focus on executive functions because a lot of research in psychopathology and neurological disorders over the last number of years have highlighted that inappropriate execution of behaviors is a component of these conditions. So the executive functions that are a collection of behaviors that have to do with how we carry out tasks have been found to be deficient in many of the different disorders. Disturbances in inhibition of actions, in attention control, the use of memory, the fluency of behavior, and behavior selection have all been highlighted as issues of concerns in a variety of different conditions, including attention deficit and hyperactivity disorders and some of the other psychological conditions in childhood. Additionally, over the years, there's been positive associations that have been found in children that show early strengths in aspects of executive functioning. So, for example, early evaluation of the capacity to delay gratification, which is a form of inhibition, is connected to both academic and later life success when it's been evaluated in children as early as the age of 4, and those kids have been tracked into their adult years and their young adult years. It's also been found that with specifically changing organization, time management, and planning, a set of actions that we see as being components of executive functions are very important in advancing school demands and achievement and productivity in school. Now, there are a group of people that are likely to have problems in executive functioning. Kids with early brain developmental complications will have those difficulties. Kids with general developmental disabilities could have those difficulties. Children with learning disabilities, children with motor coordination disabilities, and for much of our purposes today, kids with attention deficit and hyperactivity disorders, and some of the emotional disorders are persons that do have less effective executive functioning. What has been raised as a question over the years has been whether or not these executive functions can be altered. Can we improve the capacity for kids to be able to change their ability to pay attention? Can we improve their capacity to select appropriate behaviors? Can we improve their capacity to also inhibit actions and stop themselves from engaging in impulsive responses? There have been efforts designed to improve these functions in general, and there have been ones that are designed to build specific executive function skills. There have been methods that have talked about attention improvement methods and working memory methods and impulse control methods. And we want to be able to think about this as that what's the verdict on this? And so far, these methods, although they've been based on very sound logic, have not been found to be scientifically effective. There's no real strong evidence, and the verdict is in saying that these methods do not really help, especially in the case of kids with attention deficit hyperactivity disorder. This is the information that we have where we are concerned about things. If there is global instruction in the use of executive functions, teaching kids how to pay attention on computer tasks, teaching kids how to use their memory effectively, again, mostly on computer tasks, or teaching kids to be careful in their thinking about which of a variety of items might match a picture that they're looking at by looking at the very careful details of the pictures, something that's similar to like a picture search where you're looking to see what has changed. The efforts have found that early training in response inhibition and working memory do facilitate some aspects of learning, but it's mostly found in kids that have very limited resources, children that haven't had much preschool education, and it hasn't been found to be very effective in kids that have had a strong educational background or a strong experience at home. There have been specific forms of instruction tried with kids with attention deficit and hyperactivity disorders. And what's been found is that on these computer-based tasks where the kids are looking to find matching items or looking to use their memory very effectively, it does find that these kids on these computer tasks end up doing quite well in the computer tasks, and it does sometimes result in parents noticing changes in inattentiveness and hyperactivity and impulsivity, but teachers don't see a difference. Teachers don't notice these same changes. And additionally, when really careful studies have been done, it's been found that even though the kids do better on these computer-based tasks, it doesn't help with their academics. So we basically have a situation saying that the executive functions, when they've been trained in general, are ones that do not necessarily result in big changes and big improvements in the areas of concern for kids with attention deficit and hyperactivity disorder. So what we've thought about in our work is to understand and look at organizational skills and organizational skills training. The reason for this is that in working with clinical and research experience with kids with ADHD, we found out that basically the children did have a good bit of difficulty with organizing themselves and meeting the demands for organizing their behaviors at home and at school. And because of the limited impact of executive function training, we decided to work on a more practical approach to directly assist kids with problems that they encounter at school and at home. We did find in our research that children with ADHD frequently have trouble with organization, time management, and planning. And in both a regional survey and a national survey, we found that about 50% of kids with attention deficit and hyperactivity disorder in elementary school and middle school are kids that do show these impairing problems with organization, time management, and planning. And we do know from other work that poor skills in these areas seriously impair kids' classroom and homework functioning, and they are linked to increased parent-child conflict. And these are things that we wanted to see if we could help improve by coming up with a training program. The kids that we talk about are kids that might have this experience, where they think about things in dealing with schoolwork with saying, oh no, my what is due and where is it? And that they often have situations where I don't have a picture of a backpack, but they can't find things in their backpack because they have exploding backpacks. Their files are also quite messy because they just go around stuffing things in there. And it turns into a big mess. We also find that the kids do use time rather poorly, that they sometimes think, relax, I have plenty of time, but then when they end up getting close to the deadline, they say, oh no, I can't get this done, what happened to all of that time? And these are issues that we encountered quite a bit, and that many parents that consulted with us as we've done this work have had that same experience, where their kids are panicking at the last moment because they didn't use their time wisely, or they're really having a lot of trouble knowing what it is that they are supposed to do, as well as also finding the materials that they need. Now, the rationale that we developed for treating organization, time management, and planning were because we did find that kids with ADHD often have significant difficulties with organization in terms of planning and completing assignments and managing materials for school and for activities. These are the kids that are often forgetting that they need 2 cleats to be able to go to baseball practice and get to the field with only 1 cleat. The kids often have trouble remembering tasks and the materials that they need for those tasks. And they have a lot of trouble with creating a schedule to complete tasks while also having trouble keeping track of time. Altogether, we do think that this impacts academic performance and creates parent-child conflict, particularly around homework. The developmental course, we think of deficits are that by 3rd grade or so, we think that adverse effects result from organizational skills deficits begin to emerge. And we do think that left untreated, they can worsen over time or just not improve over time enough for the kids to be able to meet the new demands that they encounter as they get older. We think it compromises school success, results in family conflict, and decreases in investment in education. And in the long term, for kids with ADHD, we think that this might contribute to numerous failure experiences in school, some disengagement from school as they become less and less comfortable with the process of managing school. It is, we think, contributing to increased dropout rates, where kids with ADHD have a 3 times increased rate of dropout from high school before they finish. That it does result in decreased years of schooling. And for adults, we also think it results in problems with poor work performance. And these are the characteristic difficulties. There's misplacing or losing materials. There's careless approach to storing materials. There's often forgetting when assignments are due or tests are scheduled. There's failure to bring home materials needed for homework or turn in completed homework. And there's poor time management, time estimation, and planning difficulties that lead to difficulties completing or starting tasks. We focus a lot on schoolwork because that's what parents told us was most important to them. They said and they told us, well, yes, my child's room is a mess. There's a lot of problems with finding the right items for different toys and games at home, and that causes problems. But what they were most concerned about was helping the kids make sure that they were successful at school. What we've learned so far in our work has been kids do vary in organizational skills. Some pick it up by watching others and listening to advice. Others have difficulty developing effective routines. And some of these kids might just learn by giving a demonstration or some verbal instruction. But other kids, we think many kids with ADHD require systematic instruction with some reinforced practice on how to carry out these routines. And we found that in our work that boys are less organized than girls. Surprise, surprise. Students in special education or kids with learning challenges are less effective at organizational skills, and kids with attention and behavior control difficulties also are less organized than others. And we found that the important areas that we wanted to address was looking at lapses in memory and materials management, that there were problems with task planning, not thinking through all the steps for a project or organizing the time the right way. And that many times the kids don't use any organizational skills such as calendars or folders, and they often skip rough drafts. Our targets for organizational skills training, which we've tested out in some research studies, was to have kids become accepting of the impact of ADHD on academic functioning and organizational issues. We wanted them to also get better at carrying out tasks and getting better at the interactions with their parents and their teachers when dealing with tasks. We wanted them to be really familiar with academic tasks, and we wanted to make sure they had the needed materials and books. We wanted them to complete their work on time, and then to also demonstrate and learn how to use planning by anticipating demands, showing preparation, and spreading tasks over time. The interventions that we did develop, which I'll talk about a little bit more in detail, did find that the kids who were in this study, which is a very large study conducted in conjunction with Duke University, found that all the kids that were participating compared to a control group did improve in their ratings of organization, time management, and planning as rated by parents and teachers. And parents rated organizational skills training, this specific program I'm going to talk about, significantly more effective than a behavior modification program. The kids improved in their academic productivity. They improved in their academic performance in the organizational skills training program. They had decreased homework problems, and really importantly, they had decreased family conflicts after participating in this 20-session program. The components of the training program involve the following things. There's an orientation and psychoeducation so that everybody knows what we're doing and why we're addressing the approach. We are talking with everybody by saying that the organizational issues are presented because there are little glitches that occur to the kids, and that these are glitches that are basically like little creatures that give them mischievous messages so that they can get into trouble. They tell the kids, well, don't worry about where you put that piece of paper, just stuff it in your backpack, you'll find it later. Or don't write that down, you'll remember it later on. And when the kids can't remember things or they can't find what they need, these glitches really have a party. So we have the kids get involved with an orientation which says, I'm going to work on beating these glitches. I'm going to make myself more effective at organization. There is a parent training component where we teach parents some behavior modification strategies. And we have teachers involved in the same process where they learn to prompt the kids to use these skills in school. And then we go through a skills building approach. We work with the kids on having them learn a routine and use tools for tracking their assignments. What should they do for writing things down, and how can they use a calendar effectively? We try to make these things as simple as possible. We use paper and pencil versions for the most part because we found electronic versions were too complex for the kids that we worked with. For managing materials, we also worked with having the kids work on organizing their papers into accordion folders and to have come up with reminders on their backpacks, so they had a backpack checklist. And then we worked on having them work on organizing their desks and making sure that they had a routine for making sure they have their desks ready to go. so that they could have all the materials they need, so they wouldn't be jumping up and down to get other materials, but they also put away distractors. And then we had them work on discarding what they no longer need, because we wanted them to learn to be able to make sure they didn't have these all-encompassing backpacks. The backpacks where if you look now in April, you might find a paper that gives a reminder about providing things for a bake sale in November, because the kids haven't weeded out their backpacks well enough. We then taught the kids about managing time, to learn how to estimate how long things take to do, and to track time for task completion. So they began to recognize that things took more than 5 minutes, which they often said everything would take to do, or in some cases, to learn that things don't take forever, which they often would think as well when they got involved with a complex task. And then we taught them task planning, to learn to break down and schedule tasks one step at a time, and to figure out when to fit those tasks and those steps into their calendar and into their schedule. Overall, we found that this is important, that the routines that are typically needed for things are things for tracking assignments, that routines are needed for managing materials, including packing backpacks and having the right items for class, and to also get involved with storing papers, doing homework, and organizing lockers. And then we worked on time management and planning. Now, to give some examples of these, we wanted to be able to get a good handle on understanding and using things in a very practical way. We do have some suggestions at the end that parents can use for being able to help their kids out as well, but we wanted to be able to make sure we thought about these issues. We want to be able to have the kids, for example, have a daily assignment record. This is one idea that we thought was useful, to be able to have a single page of paper that would list all their subjects, but what they had to do for completing their homework for that day, and that we worked on having them practice doing that in our sessions, and then having them practice doing that at home and also in class. The one thing we added to this daily assignment record, which we decided to do in one page, was also to make a list of what are the items that the kids should take home with the assignments. Because many times kids will know, well, I do have to do something in my math workbook and it's pages 3 and 4, but they end up then being in a situation where the parent says, well, where is the math workbook? Oh, it's in my desk, where they forget because they don't remember to make a list of what they need to take home with them. We found the one-page version of this was really important because it gives kids enough space to write things down. If you look at planners, you often find that the kids don't have enough space. And if they don't have enough space, they're not likely to write things in. We also found it was important for the kids to have a monthly calendar in one big view so that they know what's coming up. And the process that we taught the kids and had them practice was that they get home, they learn and they look at what is due for tomorrow, but that they also use the calendar in a one-page view to be able to see what's coming up so they know what to do besides homework and getting ready for some other assignments. For managing materials, we found that the most important thing to do was to have a means of managing papers. For these children, some complex systems like 3-ring binders are really very difficult for them. It requires too many steps if you think about how you have to put papers in and out of a 3-ring binder. And the binders break and bend and the rings break, and they're not always given hole punched papers. So we wanted to have the kids use accordion folders for this. And we had them work on developing a method for separating their papers into the accordion folders with practice of them actually learning to use these folders in our sessions themselves. Parents were then taught the process of basically rewarding the kids for not having any loose papers in their backpack. For backpacks, we have the kids get involved with creating backpack checklists. It is a reminder list that they pin into the top of their backpack so that they know exactly what they need to take with them, so they wouldn't forget books, so they wouldn't forget their lunch boxes. And even with the reminder list that might not fit into the backpack, they remember to take their musical instrument on the day when they have music lessons. We want them to be involved with organizing their desks and lockers, and we did that in some cases. And then with regard to time management and planning, we wanted them to become really clear on the process of understanding how long does it take to do a number of different things. What has been found with children with attention deficit hyperactivity disorder is that they're sometimes described as being time blind. They're really not tuning into the clocks at all. And we wanted them to be clear about how long does it take to make a peanut butter and jelly sandwich? How long does it take to be able to travel from school to home, or in some school activities or school-related activities, how long does it take to turn on the home computer, to get the printer warmed up, and to be able to print a single page, so that they're not involved in a process of saying 1 minute before the bus arrives, oh, I've got to print this for school, when they know that the whole process takes much longer than just 1 minute. With regard to long-term assignments, we wanted them to get familiar with the idea that if you need to do a page worth of mathematics, or you need to write out the sentences for your spelling words, it doesn't take forever. It does take maybe 15 minutes, and maybe if the kids find that out, they'll be more willing to kind of get started on the task. In any event, the whole program was very effective. The kids really learned through this practice and instruction and the home support to do well, and we found that the program was effective for a good number of the children, with basically many of the kids at the end of the program not being able to return because they weren't, they got so good that they couldn't qualify for entry into the program anymore. Now, for kids with this issue, if there's things that can't be just done at home, then we do recommend trying things out at home and doing things systematically, and giving kids an opportunity for being able to practice with some guidance that you give them on making sure that they think very carefully about organizing themselves. That for kids with problems with attention and organization, there are clinical services that we offer at our location. The service involves twice weekly meetings for 10 to 12 weeks. We found that in the work, that if we don't do things often, that the kids have trouble following through and being able to keep going in the right direction. We want parents and teachers to both be involved in the process of prompting the kids and suggesting that they get involved. And we have found that the ideas have shown some promise for middle school students. We have a pilot study on that. And we do know that the methods are effective for these elementary school kids in 3rd to 5th grade. The services are at all of the centers of the Child Study Center. We do have it for the elementary school kids. It's been fully tested. The middle school organizational program is not fully tested but shows promising results. And we have a developing clinical effort for working with high school kids. We do also offer select workshops, and there is a program that has been developed for adults that is described here in this slide. But in terms of, these are our locations and the resources where we have all these presented, but we also want to be able to let people know if other areas of the country, if you are concerned about getting your child help with organizational skills, you can look for some behavior therapists in the area. And there are 2 important books that we want to be able to talk about. One, as I said, is one that we receive royalties for because it is one that we wrote. It is the whole organizational skills training program for therapists. It explains the whole process. It gives us session-by-session directions, and this is effective, and we think it's something that therapists can pick up if they have good behavior therapy training. Additionally, another version that's been developed for older kids in middle school by Margaret Sibley from Florida International University has also come out in a book where she explains her exact program for therapists as well. And so there are 2 resources that good behavior therapists that no kids and no ADHD can use for themselves and get themselves familiar with these efforts. Additionally, in upcoming resource for parents is The Organized Child that is being published also by Guilford and is expected to come out in the summer. And this is a program that we think is going to be very useful, and it does talk about how to do this with kids with ADHD as well as other conditions. If you have questions, we're ready to take them, and then we'll go over those now. We talked about how do I obtain this treatment in my area, and I'll go back to the idea of like looking for a good behavior therapist. The website listed here is the Association for Behavioral and Cognitive Therapy that has clinicians listed around the country by county and zip code. And if you talk with them about this and talk with them about these books, they might be able to help you out with that. For kids that are older in high school and older, there's programs that are being developed around the country, but they're not been fully tested yet. So we don't necessarily have clear, exact ideas about what to do for those kids, but people are doing some of this work and looking into this as a possibility. We want to know if parents want to know if there's workshops that we offer to parents, and we do offer those. We offer those oftentimes on a Thursday evening, and those are here at our center in New York. but we also do some outreach in our offices in Long Island and New Jersey as well, with sometimes the school systems. So you can check our website for this at www.nylangone.org/CSC, or you can call our care management team at 646-754-5000. So any suggestions if a child can't read his own handwriting for using a paper planner? The idea that I would think about that would be to see about the possibility of making a larger, perhaps a daily assignment record. So if there's one page for the different assignments, I think that might help when there's problems with handwriting. If there's not a way of doing that, then I think what can be requested is to see about some accommodations so that another student could provide a copy of what they've written down, or asking a teacher to perhaps provide a brief written response. Those are some things that I think that might help out with that. For older kids, if they are allowed to use a phone, sometimes they can go ahead and take a picture of the assignment, and they have that in their phone, or sometimes through the dictation part, they can dictate what it is that that they have been listed on the blackboard, or what's been listed for what the assignment is. Other questions? We're waiting to see. Thank you. Oh, there we go. Okay. So other kids get their assignments through online sources, and the kids do have lots of access to many distractions, and that means that they have the computer at their hands. So there is an app called Self-Control that does allow you to shut off different applications and different websites for specific periods of time. So very often that might be a way of being able to work things out, where the computer is able to get access to the school website, but they're not, and the Google Docs, but not necessarily YouTube and other things that might lead them to being quite getting distracted. Someone asked about, I struggle getting my daughter to school on time because she's so easily distracted and thinks it's okay to be late. Well, to avoid arguments and sweating every morning, we want to be able to make sure that you have your kids learn about exactly how long it takes to do all the different steps, and then together have a discussion about working backwards. If getting ready for school requires a half hour, then it's a good idea to see about setting bedtime at a point that, or wake-up time, a good amount of time before that happens. We also think even for older kids, it's a good idea for parents to be involved with prompting their kids as they're moving along and giving them small steps and rewarding them through praise for the small steps that they accomplish on time. We got one other final thing to consider is that for some kids this has worked and doesn't result in too many issues. If kids are having trouble getting up on time and being ready on time, then you say, well, I guess you need to get more sleep. So we have to take that time off your bedtime. And that often works with some kids. Sometimes kids leave needed materials at school or don't write down their assignments because then they don't have to do it. Well, that's exactly a strategy that some kids use. We sometimes find that the best thing to do is to be able to work on positively rewarding kids for knowing exactly what their assignments are and for making sure they bring everything home. So we try to be able to turn it into something that they get rewards for doing the right things, and that sometimes motivates them. We have to recognize that for kids with ADHD, behavior modification is a really important part of some of the treatment efforts, and it should be something that's incorporated in your planning and thinking about your kids. Does medication help with organizational skills? It does to some extent. We have done a study that looked at just the effect of medication without any training, and the kids, while on medication, did improve significantly in their organizational skills. We did find in some comparisons, however, that they didn't improve as much as they did with the training. And many kids on medication still demonstrate a lot of difficulties with organization. In fact, that was one of the reasons why we did initiate our studies. We were doing work with a lot of kids on medication and still finding that even though their attention was good, even though their impulsivity and hyperactivity were reduced, that the kids were still having lots of problems with organization. And so that's not necessarily a panacea. The materials for the backpack checklist, it's nothing fancy. So we want to think about this. So get an ID badge holder. They're plastic holders, and you can insert a index card in there, and you can make the checklist on the index card and then get a large safety pin and pin that into the top of the backpack. None of the work that we did was very fancy, and we found that that was a very useful method for helping the kids have a backpack checklist that they see when they close up their backpack, and it's the last thing that they see on the inside. We are going to have the additional handout that we'll be sending to you that talk about some ideas that you might be able to use at home, and we'll be passing that along. And I want to be able to just say on behalf of the Child Study Center, thank you for joining me today. Once you leave the webinar, we would like that you fill out a survey and complete it so we can find out some more information about how to make these better. And we're also going to receive a follow-up email a day or two with a link to a recording of today's presentation. And we hope you can join us for the next version of the talk in a few weeks on May 2nd, given by Samantha Buza on parental self-care, how to take time to recharge from your experiences with your kids. So thank you very much, and have a good afternoon.